Hello everyone. So in this video we are going to discuss about the diuretics which act on the loop of Henle. So the drugs which act on loop of Henle, or in other words we can say that they are loop diuretics. So loop diuretics. So they are acting on the loop of Henle, that's why they are known as loop diuretics. So in the loop of Henle where they act, basically they are acting on the thick ascending limb of loop of Henle. Thick ascending limb of loop of Henle. So in the thick ascending limb of loop of Henle there is one symporter, that is from where the sodium gets reabsorbed, potassium is also reabsorbed, and chloride is also get reabsorbed. So here these drugs, loop diuretics, were acting on these symporter, that is sodium potassium 2 chloride symport, that is sodium potassium 2 chloride symport. So here it inhibit the functions of these symporter, and the sodium and potassium and chloride will not get reabsorbed. So loop diuretics, basically these drugs, in these the drugs which include are furosemide, torsemide, furosemide, and the third one, that is bumetanide. So these drugs are the loop diuretics drugs, furosemide, torsemide and bumetanide. So what loop diuretics have? So loop diuretics, the other name is also known as forced diuretics. So other name is forced diuretics. So these drugs have the high ceiling effect, like they have more high efficacy. So these have high ceiling efficacy or diuretics. And the other, these drugs loses the large amount of sodium and water in urine. So these drugs loses large amount of sodium and water in urine. And also these drugs, like these channels, from these channels almost 20 to 25% sodium is get reabsorbed. But if this symport is not working, then it will gonna lose that sodium. So where we can use these drugs? So uses of these drugs like loop diuretics are used in edema conditions, because it loses lots of water and sodium outside in the urine. So in edema also we can use these drugs. In hypertensive emergency we use these drugs. We also use in the hypercalcemia conditions, and also in the bromide and iodide poisoning we use these drugs. We used these drugs. And in other words we can say that in the treatment of hypercalcemia we can use the loop diuretics. So in treatment of hypercalcemia we use the loop diuretics. So that's all about the loop diuretics. In next video I'm going to explain about the thiazides. So for that time, thank you, bye bye guys.